Hello, my name is Dr. Tom Walters and I'm one of the anaesthetic registrars based at Glenfield Hospital in Leicester. Today, I'm presenting a case series of patients with unilateral diaphragmatic palsy, UDP, who have undergone cardiopulmonary exercise testing, CPEX. Diaphragmatic palsy is a condition characterized by diaphragmatic weakness causing impairment in caudal displacement of the diaphragm during inspiration. A literature review identified 3 studies of patients with UDP undergoing CPEX. And you can see the 3 papers on the bottom of the slide. Pereira et al. And Bonavie et al. Found evidence of exercise limitation in cohorts of 35 and 10 patients respectively. The aim of this case series is to identify patterns of exercise physiology in a cohort of patients with UDP. 21 patients underwent CPEX as part of the perioperative workup prior to thoracic surgery. Tests were conducted in accordance with the POET's clinical guidelines using a cyclogometer. Some patient characteristics are shown in this table. Of note, the average BMI of the group was 32. The raw data for this group is displayed in this table. 4 themes were identified. Firstly, a low proportion of patients had a normal exercise capacity. The average VO2 peak was 72% predicted, and 67% of patients had a VO2 peak less than 80% predicted. Also, 76% of patients had an AT of less than 11. This reduction in VO2 peak and AT may be explained by ventilatory impairment caused by UDP, leading to respiratory limitation during exercise. Secondly, a high proportion of patients had encroachment on their predicted maximal voluntary ventilation. The average maximal minute ventilation as a percentage of predicted maximal voluntary ventilation was 84%. This is again a sign of ventilatory limitation. Thirdly, a high proportion of patients had a high heart rate reserve. The average maximum heart rate for these patients was 80% of their predicted. This high heart rate reserve may be caused by early respiratory compromise and ventilatory limitation during exercise, causing a shortened test because of UDP. And lastly, qualitative data obtained from the test report showed that some patients displayed patterns of dysfunctional breathing despite normal exercise capacity. So these findings are consistent with the very small amount of CPEX data in patients with UDP. Thank you very much.